Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. In today's episode, we're going to discuss the COVID-19 vaccine. As always, our goal is to inform and to help start conversation.
Like many other people, I was skeptical about the COVID-19 vaccines, and I'm a vaxxer, a firm believer in being vaccinated. But I thought to myself, how could we already have a safe vaccine for a brand new virus? Or not really brand new, but new.
Yes.
I swallowed my pride and my doubts, and I listened to what I tell my patients about vaccines. And I put my money where my mouth is. When we get the flu shot each year, even though their variants and strands change from year to year, not in hopes that you'll catch the flu, but because if you do, your flu symptoms will not be as severe or life-threatening. 50% protection is better than no protection at all. So Ashley and I, being the vaxxers and firm believers of vaccines that we are, we put our money where our mouth is, and we couldn't sit here and have this conversation about this particular vaccine
if we hadn't
gotten vaxxed. Like, that would make us
hypocrites,
fakes, phonies. And that's one thing I'm like, not like, what you see is what you get. So we bit the bullet and we did our due diligence, and we tell our patients to do theirs.
Absolutely. And the CDC does recommend that any person that's 16 years and older be vaccinated when it's available. If you are, or you were like me and doubting safety, side effects, there are benefits to being vaccinated. The United States available vaccines have been shown to be highly effective at preventing the COVID-19 infection. Experts believe that getting the COVID-19 vaccine may also help you from getting seriously ill, even if you do get COVID-19, just like with the flu shot. Getting vaccinated yourself will also protect the people around you, which I feel a calling to do as a nurse. Vaccines are a safe way to build protection, and the combination of getting the vaccine and following the recommendations by the CDC, like wear a mask, hand wash, social distance, is the best way to protect yourself from getting COVID-19.
So you guys are probably asking, oh, I had COVID-19. Should I still get the vaccination?
I got this question on Friday.
You did?
By a patient.
So I'm interested to hear what your providers are telling your patients. I know the recommendation from the CDC is yes, but what did you tell your patient?
That she probably does have some antibodies from that COVID infection that she had. However, we don't know how long they last.
Bingo.
And so therefore, in my personal opinion, was to her to get vaccinated. And she was planning a big out-of-state trip as well. So I told her, of course, to talk to the doctor about it. He was probably a little bit more well-versed with the vaccinations than I was. And
sure enough,
he told her the same thing that I did.
Awesome. Because that is what the CDC is recommending.
Yes.
When germs invade our bodies, they attack and multiply, which causes an invasion or an infection. They both can be used, interchangeably. Our immune systems try to fight that infection. So your blood contains red cells, and we all know that that carries oxygen to tissues and organs. And we have white cells or immune cells to help fight infection. And there are a few different types of white blood cells, and that all in of itself could be a whole totally different podcast episode.
For sure. Without a doubt.
So we're trying to simplify.
Yes. Well, and we want to make this to where not only nurses can listen to it, but anybody else can listen to it and understand it as well.
So when a person is infected, let's say in this instance with COVID-19, it takes days or weeks for their bodies to make and use germ-fighting tools that we need to get over an infection. So after the person's immune system remembers what it learned about that infection and how to protect your body against that infection if it comes across it again.
This is why the second vaccination is causing people to have more of a response than the first
one. Absolutely, because the first one is just like, I don't
your
know,
body's
let's
just now
use a common
recognizing
cold,
yeah.
right? Let's say it's the first time you ever had a cold or whatever. So your body's like, something here isn't right. So I'm going to try to learn about it, do what I need to do to kind of get rid of it. So the second vaccine that you're getting, your body's like, oh, I don't know your name, but I've seen your face before.
Right. And I know
you're
exactly
familiar
what to
me.
To get you out of here.
Exactly.
And if that's fever or whatever
body
happens,
aches, chills, you know, like most vaccinations, those are your common side effects.
Right.
Fever,
so
chills.
You're
headaches.
welcome. Your immune system works.
Absolutely. So your body keeps a few of those memory cells that we talked about, and it goes into action quickly when the body encounters that same virus again. And when the familiar antigens are detected, the body produces antibodies to attack them. Experts are still learning how long these antibodies from COVID-19 last. That's why I was so curious to see what, your place of employment was telling, your patients, because we all know what the CDC says, and I trust in the CDC because it's science, but I also like to know, what our local docs and mid-level providers are telling their patients.
Absolutely.
Too.
So even with different companies working hard to make as many vaccines as possible, there is a constant question if there will be enough, and not just for the United States, but for the entire world. I did read an interesting article in the New England Journal of Medicine about prioritizing who gets vaccinated first. And this is something that's so up Rosa's alley and not mine that I was surprised that I'm the one that stumbled across this.
Yeah.
Me being who I am, if you ask me who needs to get vaccinated first, I'm going to tell you the people that are working directly with COVID infected patients, those nurses, those doctors, the respiratory therapists, phlebotomists, anybody
healthcare workers, period.
Any kind of healthcare worker or person.
And then your
that's
essential workers.
Right.
Yeah.
But first it needs to go to the people that are in the hospital.
Absolutely.
I would say that the person cleaning the room of an infected COVID patient should get vaccinated before me because I'm an outpatient. That just makes sense to me.
It does.
They may not actually technically be a healthcare worker, but they work in the healthcare system.
Field, yeah.
And they're in with a room where those particles and viruses are laying on the surfaces. And we know that already. So when I was reading the article, it was interesting to know that the first to become vaccinated in the United States were government officials and their workers. Me being the devil's advocate that I am, it was like, well, was this to show that they felt the vaccines were safe and they were urging Americans to get vaccinated? Or was this to help protect themselves? I'm just saying, I am not a very political person, but if you tell me that a person in front of me is part of our government and is into politics in some kind of way, I'm not going to believe. Probably.
Wow, they're like
it's
used
kind of
car
like a grain
salesman.
of salt, you know?
That used car salesman.
And I'm not saying that everybody that's in politics is not honest, but I'm just saying we're going to take a long time to build. And so I don't think that we'll ever really know the answer to that question. But, what does concern me, and I think what concerns other people's is misleading prioritization, and I think that that's causing a problem.
Well, let's take this to the beginning because you have a point here. In the beginning,
I know where you're going.
I know your ESP. In the beginning, when the normal Joe from the street couldn't even be tested to see whether or not they had COVID.
And they were sick.
And they were sick with symptoms. But you had celebrities who only had like a runny nose, or they couldn't taste their food, or didn't have any symptoms at all.
Being tested.
So this to me is not surprising or shocking. It's actually making me upset and disgusted.
Well, and it's so funny because that was my next point is, what is it to keep others like celebrities and the wealthy from getting their vaccines over maybe geriatric patients that have a lot of comorbidities if they're completely healthy? There's no line. You can't draw a line at that point. And just like you said, they were just getting tested quickly, more easily than the sick people.
And sometimes just for the sake of it. They weren't even sick.
Right. And so I just don't know that with the limited availability that's there, that nurses who wanted to get tested were told, or they were exposed and they weren't having symptoms, and should they get tested, were told to, quote, use their judgment.
Absolutely.
Oh, it drives me up the wall.
Yeah, it does. As a nurse, it is unfathomable that in 2021, with all the medical advances that we have and all the education that's supposed to be leading our government, that this could even happen. But am I surprised?
No, you're not. And it's funny because I know that wholeheartedly. So when I found this article, I sent it to Rosa. I was like, Rosa, what do you think about this? And she's like, girl, go for it. I'm like, I don't even know why I sent it to her. Because she needed to read it because I knew she'd appreciate it. This is usually not where I go.
I love it. I love that you're being so open-minded because that is my rabbit hole for sure.
If anybody is listening to this and they don't know, the New England Journal of Medicine, everything that's related to COVID is free. You don't have to pay for it. So they have a ton of articles. I've read a lot of them. They're good. But I do want to talk about vaccines. And there are a couple of companies that are making COVID vaccines. But I wanted to get into what mRNA is, because that's what these are mRNA vaccines. A mRNA vaccine does not contain any viral proteins like a traditional vaccine does. Just the information that our own cells need to produce a virus trait that will trigger our immune system to respond. That's all this vaccine is doing, is having our own immune system be able to respond when it sees, the virus, which is what a lot of vaccines are doing. It's just done in a slightly different manner.
Way. Absolutely.
The first company we're going to talk about is Pfizer, the Pfizer biotech. It is an mRNA vaccine. It's 2 shots given 21 days apart. It's given into the upper muscle of the arm, the deltoid. It does not contain eggs, latex, or preservatives. This is why it has to be taken straight from a refrigerator. It usually sits out for about 30 minutes and then the vaccine's given. And if it's not used within a certain amount of time, it's
discarded.
Is done. This is recommended for ages 16 and older, and you should not get the vaccine if you've had a severe reaction to the first one, obviously, or if you are allergic to PEG or polysorbate. Common side effects are the same as any injections: pain, swelling, and redness at the injection site, fever, chills, fatigue, headache. And fever, chills, fatigue, headache were more common after the second dose of the vaccine.
So Moderna has a vaccination or a vaccine for COVID-19 that uses the mRNA vaccine. It's 2 shots within 28 days, and it's also given in the muscle of your upper arm called the deltoid. It also does not contain eggs, latex, or preservatives, and it's recommended for those who are 18 years and older. You should not get the vaccine if you've had a severe reaction to the first dose, or if you're allergic to PEG or polysorbate. The side effects are the same. So we're looking at pain at the injection site, swelling at the injection site, redness at the injection sites, fever, chills, or headache. And like with the second dose of the previous vaccine, the side effects like fever, chills, fatigue, and headache are more common after you take that second dose.
I know that Johnson & Johnson is currently working on a vaccine. It's not out at the time that we are recording this, but it is supposed to be a 1-shot vaccine that is also going to be given into the arm. The type of vaccine, it's not going to be an mRNA. It's actually going to be a vaccine that was derived from the adenovirus, which is a common cold. I don't have a lot of information on that one as of yet, just because it's
still pending.
It's still pending. It's still pending with the emergency use authorization, but it is supposed to be very effective.
Yes. So from what I gathered from the news, of course, it doesn't have to be stored in that, low temperature like the other 2 are.
Right.
And it is only 1 dose. And they said it is more effective in preventing the seriousness of the disease. So they're saying even if you do get sick, the severity of it is way less. The chances of you being ventilated from this disease is way less.
Right.
So it's a good option. One, it's a good option, I feel, for like people who are non-compliant. Maybe they'll go for the first shot and then be like, to heck with the second.
Oh, absolutely.
You know what I mean?
Or people that were worried about the mRNA, because this is not an mRNA.
It's a different type.
It's a different type of vaccine.
Yeah.
It's going to be still for people that are 18 years and older. It's supposed to be 85% effective, as to where the Pfizer, biotech, and the Moderna are over 90%. They're both over 90% effective after the second shot.
Absolutely. And I think that's really important because, you know, if you're out here and you got the first one and you're thinking you're one and done, no.
I mean, it does give you about 65% protection depending upon what article you read.
Yeah, I heard 50-50.
Yeah, so I mean, that's just as good as the flu shot.
Absolutely.
So at that point, yes, that's fine, but I think it goes up to 92-ish, 90.
Yes.
You know, I think, again, it all depends on a lot of the articles that you read and the data that comes out. But again, you're in the upper 90s.
I'll take 92. 92% sounds a lot better than 50, but 50 sounds better than 0.
And
I'm just going to leave it at that.
I'm the same. I feel the same exact way. So it is going to be, I think, a nice to have, but it's not quite available at the time that we are recording this. It might be by the time that it airs, though.
They have just sent to the FDA for authorization of release. So we are actually not going to know for about another 3 or 4 weeks whether it gets approved.
Right.
So I kind of want to talk about herd immunity because we mentioned it last year. And I think now all of us kind of know a little bit more about it. So I like to simplify things. According to the CDC, herd immunity is when a sufficient proportion of a population is immune to an infectious disease through vaccination or being exposed to it from a prior illness. And this helps to stop the spread of the virus from person to person. Those who are not vaccinated are offered some protection because the virus has little opportunity to spread within the community. 94% of the population must be immune to stop the chain of transmission.
I gotta say it. So for the people that are out there that are anti-vaxxers,
please break it down, Ashley.
You're welcome.
That you and I,
you're welcome,
and everybody else is trying to be vaccinated so that you, the anti-vaxxer, does not receive COVID-19.
Yes.
The 2 ways to accomplish this, like I mentioned before, is through natural infection, which is catching the virus and building the antibodies and immunity, to the virus. But we still don't know how long that natural immunity lasts.
Well, I think the last that I checked, when you do plasma donation after you've had COVID-19, they only allow for 6 donations.
Okay.
So I think that has something to say that there must be some kind of data out there that I wonder if the amount of antibodies start dropping off at that point in the plasma that you donate to make the convalescent plasma for
patients that
are sick. It's not as effective.
And I can see that. And of course, the other way to accomplish the herd immunity is by vaccination. So the goal is to vaccinate as many people as possible to help the spread of COVID-19 and to save more lives. And so I kind of look at it as having a room full of people and then literally playing dodgeball. Like if you're vaccinated, then your chances of being hit are slim to none. And when you aren't vaccinated and that ball hits you, now you're sick. I totally believe Ashley when she says you should be thanking us for helping keep you, your loved ones, and your family safe. I want to take a minute to thank all of those who have been vaccinated.
Absolutely.
And if you're questioning yourself or you're on the fence about it, I'm hoping that maybe listening to this podcast or this episode of this podcast will help sway you into being vaccinated. And not just for the COVID-19 vaccination, but for vaccinations, period.
Yeah, absolutely. And like I said, the New England Journal of Medicine has all of the information available online. And I think once you start reading the data, it's good. I mean, it's got more data than some of the medicines that are out there and approved for use for rare diseases that they don't have the patient population for it. I'm just going to throw that out there.
And, I'm all about Dr. Fauci. I'm Team Fauci, like 100%. It's like a brilliant mind. And so according to Dr. Fauci, if we get 75 to 80% of the population vaccinated, we may actually have enough herd immunity protecting our society that as we get closer to the end of this year, which is 2021, we might be able to approach some degree of normality that's so close to what we had before. And all of this can come from vaccinating.
Right. So 2022 will be our year.
Everybody will hopefully be living their best lives in 2022 because they vaccinated in 2021.
Exactly. And we're not saying that if you get vaccinated, you won't catch COVID-19 or its variant. However, as we discussed in the beginning of the episode, but if you do, the hope is that the symptoms will be less severe or life-threatening than if you were not vaccinated at all. We've said this probably several times. Some protection is better than none at all. And as nurses, I think it's important that we continue to educate ourselves and our patients about COVID-19, hand washing, mask wearing, and social distancing, even when vaccinated. But we must model what we teach. We, Rosa and I, have made a clear stance and have verbalized our opinions and beliefs about vaccinating. Both of us have been vaccinated with both doses in the series of vaccines we received. And we're hoping that you guys will vaccinate as well.
Not just for yourself, but for your family, your friends, and your patients. As always, we'll link our references to our website, www.thenursingpostpodcast.com. Be sure to subscribe to our podcast on your favorite platform and leave us some of your thoughts. Thanks again for listening to The Nurse.